taxes, healthcare, and wages. The real financial differences between Australia and the U.S. What if the country you think pays better is actually bleeding your money dry through invisible taxes? And what if the country with lower salaries is actually setting you up for a more secure future? I'm about to show you the numbers nobody talks about, the ones that change everything. And I promise you, by the end, you'll look at job offers from Australia and America completely differently. But wait, before we begin, please subscribe to ensure that you never miss out on any of my essential stuff. Comment, I subscribe below, and I will personally welcome you to our community. With that said, let's get started. Let's start with the wage illusion. It looks like America wins. A software engineer in San Francisco pulls in $150,000. Sydney, $95,000. On paper, it's not even close. America looks like the obvious choice. But let me show you what happens next. That San Francisco engineer sits down to file taxes. Federal tax bracket, 24%. California state income tax, 10.23%. Social Security, 6.2%. Medicare, 1.45%. Added up, 42% gone before healthcare even enters the conversation. So $150,000 becomes $87,000. But wait, his health insurance through work costs $18,000 a year. That's not from his take-home. That's an addition. So really? $69,000 left to actually live on. Now let's look at the Sydney engineer making $95,000. Tax bracket, 21%. Medicare levy, 2%. Total, 23%. Take-home, $73,150. Here's where it gets interesting. Healthcare is already paid for. It's in the taxes. No deductible. No monthly premium. Walk into any doctor. It's done. But there's more. Australia adds 12% employer superannuation on top of salary. That $95,000? Legally, the employer must add $11,400 to a retirement account for you. Automatically. So the real comparison is San Francisco, $69,000 take home to live on. Sydney, $73,150 take home plus $11,400 automatically invested for retirement. Sydney is already winning. But that's just the beginning. I want to tell you about James. He's 52. Worked in tech his whole life in Melbourne. Made good money. Not great, but good. Then he got an offer from San Francisco. $165,000. It felt like winning the lottery. I was excited. James told me in 2024, I thought I'd finally make real money. His first year, he couldn't believe the tax bill. Federal, state, Social Security, Medicare. It all added up to something that felt like a betrayal. And then the health insurance documents came. I was making more in Australia on $110,000, he said. This doesn't make sense. The problem wasn't that he was bad with money. The problem was that nobody explains the layering. It's not one big number. It's 1,000 cuts. Federal tax, state tax, payroll tax, insurance premium, deductible, copay, out-of-pocket maximum. In Australia, tax, Medicare levy, done. Healthcare, covered. But let me show you why healthcare is the real story here. Imagine going to the doctor and not knowing if you'll go bankrupt. That's the reality for 33 million Americans right now. I want to tell you about Patricia. She's 61. Spent 35 years as a nurse. Never missed a payment. Never asked for charity. Did everything right. Then she got diagnosed with type 2 diabetes. Her insulin pen, $300 a month. Her insurance, it didn't cover a single dollar until she'd spent $3,000 out of pocket first. That's called a deductible. You pay it yourself before insurance even kicks in. So Patricia did the math. $3,600 for insulin alone. $180 a month for the health insurance itself. Plus other medications. Plus doctor visits. She couldn't do it. So she started buying insulin from Canada online. Cheaper, but technically illegal for Americans. She broke the law to survive. I never thought I'd become a criminal for staying alive, Patricia told me. Patricia's story isn't rare. It's not even unusual. The CDC found that 45.8 million Americans delayed or skipped medical care because of cost. In 2023, just 1 year, think about that, 45 million people choosing between health and money. In Australia, you walk into a doctor. You might wait a bit, but you pay nothing. Prescriptions have a cap, $45 for most people, $12.50 if you're a pensioner. That's it. No deductible, no surprise bills, no bankruptcy letters arriving in the mail 3 years after surgery. Here's what's wild, though. Australia also has lower wages. So how is this even fair to Australian workers? The answer is, wages aren't the same thing as income. Let me introduce you to David and Sarah. Same age, both 45, both married with kids. David lives in Brisbane, Australia. He makes $95,000 a year. After tax and Medicare Levy, he takes home about $74,500. His health care? Fully covered. No bills. No surprises. His kids go to the doctor? Free. His wife needs a specialist? He calls, gets an appointment, pays nothing. His employer adds 12% to his superannuation. That's $11,400 a year. That goes directly to retirement savings. He doesn't even see it. It's just there, growing. So David's real income is $74,500 take home plus $11,400 in forced retirement savings. That's $85,900 total value. Sarah lives in Austin, Texas. She makes $130,000 a year. After federal tax, 22%, Social Security, 6.2%, Medicare, 1.45%. She takes home $107,000. But that $130,000 doesn't include health care. Her family plan costs $18,000 a year. So her real take-home from salary, $89,000. Then she needs to contribute to her 401k for retirement. If she wants to match David's $11,400 contribution, that's another $8,769. Let's say 8% contribution on her salary. Maybe her employer matches 3%, adding another $3,900. So Sarah's real value is $89,000 minus $11,400 retirement contribution equals $77,600 take home to actually live on, plus $3,900 in employer match. That's $81,500 total value. But it's not the same. David's $11,400 went in without him feeling it. Sarah had to choose whether to pay rent or invest for retirement. David still wins. And he's got something Sarah doesn't have, peace of mind. But here's where America has a card to play. And it's the one thing that might actually give it the edge. If you're disciplined, if you're lucky, if you survive long enough. Meet Robert. He's 58, works in Silicon Valley. Started in 1998, making $85,000. For 25 years, he maxed out his 401k. He didn't spend money recklessly. He invested in tech stocks. He benefited from 25 years of U.S. market growth, averaging 9.8% per year. In 2024, Robert's retirement portfolio is $2.8 million. If Robert had made the same moves in Australia, maxed his superannuation contributions, invested aggressively, he'd have maybe $1.2 million today. The Australian market averages 8.2% returns. Different trajectory. America's system gives you potential, Robert said. If you're disciplined and lucky, you can build serious wealth. But here's the other statistic. 68% of Americans retire with less than $10,000 in savings. Meanwhile, only 12% of Australians face retirement income inadequacy. The system's safety net means most people will be okay. Most, not wealthy. But okay, so which country actually wins? The answer isn't what you think. And it depends on one critical thing. What happens if you get sick? Meet Jennifer. She's 47, had breast cancer. The treatment? Outstanding. Literally saved her life. She's cancer-free now. That's the good news. The bill? $340,000. Her insurance company covered $190,000. She was responsible for $150,000. In 2021, Jennifer filed for bankruptcy. She lost her house. She's living with her sister now. And here's what she said to me. The worst part? I was grateful. Grateful they let me go bankrupt instead of denying care. Let that sink in. She was grateful for bankruptcy instead of death. The American Journal of Public Health found that medical debt is the #1 cause of personal bankruptcy in the U.S. 66% of all bankruptcies. It's not failed business ventures or gambling addiction. It's getting sick. In Australia, medical debt doesn't even exist as a bankruptcy category. It's not a thing. If you get cancer, you get treated. Your house is safe. The risk profile is completely different. Here's the irony of all this. Americans are moving to Australia. Australians are moving to America. Both for different reasons. Both chasing something. The Americans are chasing stability, healthcare security, work-life balance, time with family that doesn't come with medical anxiety. The Australians, they're chasing earnings potential. They're young, ambitious, and they think, I'll work hard for 7 years in San Francisco, accumulate wealth fast, then move back home. One couple did exactly that. They sold their Silicon Valley house for $2.3 million, moved to Melbourne, bought an equivalent house for $1.2 million. They invested the $1.1 million difference in index funds. We traded career growth for life back, they said. The opposite couple moved from Melbourne to San Francisco in 2021. They say, we're here for 7 years. Earn hard, invest, and move back by age 40. Both strategies make sense. Both reveal something true about each country. Here's what both countries don't want you to know. There's no objectively right answer. Australia says, you'll never be rich, but you'll likely be fine. The system will catch you. Healthcare is free. Retirement is secure. You'll have time for your kids. Your maximum worry is that you won't have enough for a fancy house. But you won't starve. You won't go bankrupt from getting sick. America says, you could be very rich or you could lose everything. The safety net has holes. Healthcare can ruin you, but the ceiling is higher. If you're disciplined and lucky, you can build generational wealth. Your potential is nearly unlimited. Those aren't the same thing. The variable that actually matters comes down to you. How old are you? If you're 25, aggressive and healthy, America might offer more. If you're 45, tired with kids, and want to sleep at night, Australia might give you something money can't buy. What's your family situation? Got kids with medical issues? Australia's system protects you. Want to invest aggressively for retirement? America allows it. What's your risk tolerance? Can you handle years of uncertainty? America's for you. Do you need stability? Australia has it. But here's something that's changing right now. In 2025, Australia is raising wages for tradespeople, nurses, and hospitality workers faster than America. Meanwhile, America's tech salaries are growing slower than inflation for the first time since 2015. The gap is shrinking. So what happens when these systems converge? What happens when both countries realize what works? Here's what I actually want to know. If you had to choose between earning $150,000 with healthcare anxiety, constantly worrying about one bad diagnosis away from bankruptcy, or earning $95,000 with zero medical worries, knowing your healthcare is covered, your retirement is guaranteed, and you have time for your life, which country's life would you actually pick? And more importantly, what made you choose that? Tell me in the comments. I genuinely want to hear this, because your answer says something about what you actually value when money isn't the only factor.